Ivermectin, is it for humans, for horses, or both? Today, we're going to find that out on this episode of Ask Dr. David. Hi, David.
Hi there. Good to see you.
Good to see you too. So first thing that a lot of people want to know in this controversy regarding ivermectin, is ivermectin safe for humans to use?
Ivermectin has been FDA approved for the treatment of intestinal parasites in humans for over 40 years. It is something that is a milligram per kilogram dosing that has been established, and this particular dose has been identified by the FDA as something that is generally considered safe and okay to use in humans.
And is this available over the counter, or does it require a prescription?
This particular product is available only by prescription. It is available mostly as tablets, but there are also lotions available.
Now, I want to talk about something that's called off-label usage of a medication. I'm wondering first if you could talk about what off-label usage is.
Yes. So there are many medications that are FDA approved that a doctor or other healthcare provider who can prescribe at their discretion when contemplating the benefits versus risks are allowed to use, even if there's not an approval for that particular symptom or that particular diagnosis.
So in terms of off usage of ivermectin, how has it been used off usage previously? I know you mentioned some lotions or something.
Yes, so the intestinal parasites is what it's been approved for, but scabies, which is where bugs are crawling under the skin, that is something that people are allowed to use off-label for the tablets. There's also a lotion, that for head lice, it's also being used, as well as for scabies, it's being used, and there's both topical as well as oral forms.
And to be clear, though, those still need to be prescribed by a doctor once they've run a medical check and checked for other drug usage of the patient and that kind of thing for safety.
Absolutely. Just like with every other prescription, there should always be a drug interaction checker, because there is the potential with certain types of medications that there could be issues if used in combination.
Now, I know that some people have been reporting or saying that that there's not really studies that are being done right now to determine whether or not ivermectin could be used off-label for the treatment of COVID, for example. I'm wondering if you can address that.
Yeah, so there are actually 2 large studies underway that is looking at this. There have been smaller studies been done. A lot of there have anecdotal reports where people are just reporting it as being done. Some of the studies that have been done have been very complicated, because there's been claims of plagiarism that's been found in some of the studies, and one of the studies in particular. There's been claims of data manipulation as well when there's been undergone a independent review by peers. That's one of the things that when studies are done, they're first put out there, but then there are peer review that goes on in order to gauge the legitimacy of that type of study, how good quality it is.
Now, I know that ivermectin is also used for veterinarian purposes, and I'm wondering if you can tell me, is ivermectin the same drug that's used when it's used for humans compared to veterinary animals? What's the same, what's different, that kind of thing?
So the chemical ivermectin itself is the same. Veterinary products are not regulated the way that products for human consumption are. There will be other ingredients, especially since these are mostly coming as pastes in a tube. So there's going to be other ingredients that could be in there that may not have been looked at all in terms of safety for use in humans. But the other thing is that the sheer concentration, the amount of milligrams, for instance, in a tube of ivermectin that is available for veterinary use, can have 6 grams, 23 grams within a single tube. Whereas when a person is using it according to the FDA dosing for the product, they're talking about milligrams. So, since it's like 0.2 milligrams per kilogram, people would be talking about a 10 milligram, 20 milligram, 30 milligram type of dose. And these tubes are giving grams worth. And as many people know, it's 1,000 milligrams in 1 gram. And so that's where the problem has become, where people have taken these products and they've taken very, very high doses of ivermectin, and that's caused toxicity for people, and that's not toxicity that would be seen at the doses that are FDA approved for human use.
So if I understand what you're saying, the situation with veterinary medicine or the veterinary version of ivermectin is twofold. One, it's that they are in incredibly high concentrations compared to what has been approved for human use, and that's because they are largely used for livestock that can weigh hundreds, if not thousands, of pounds. And additionally, they are within the inactive ingredients that the ivermectin itself is in, can themselves be potentially toxic for humans because they haven't been tested before. Am I understanding that?
Yeah, or how much they're actually humans actually getting in that, because again, we don't necessarily know that either.
Okay. Now, do you know of people who have taken ivermectin for the treatment of coronavirus or as a prevention for COVID?
Yes, there have been anecdotal scenarios. I do know people who have told me that they've gotten it from other doctors. I've had people who told me that they've had very quick recoveries from it within 24 to 48 hours. But I also want to point out that there are people who get better from COVID within 24 to 48 hours with doing nothing whatsoever. So that's the whole reason why we need to have controlled studies where people are looking at a placebo versus a control. And then furthermore, because of the fact that we have lots of protocols that we use for natural immune strengthening and controlling of inflammation as well.
Now, have you personally or anybody in your practice been prescribing ivermectin as an off-label usage for COVID?
No, this is not something that we have used in our practice before. Being that I prefer to do things from a natural perspective, one of the things that has been purported that ivermectin may be useful for is that it does have anti-inflammatory properties. Okay. And we know that inflammation and hyperinflammation is what gets a lot of people in severe trouble with COVID. We heard about the cytokine storms, the inflammation that's destroying lung tissue, liquefying it. But I also know that there are lots of things from a natural perspective that one can do, such as maintaining optimized vitamin D and zinc levels and making sure that their methylation genetics are properly tended to. Those are things that people can be doing long-term as a preventive, not just for, for reducing this potential severity of COVID, but also for influenza and lots of other infections. But in addition, there are things that people can take, such as quercetin, such as curcumin, high-dose omega-3 fatty acids, that can be done on the start of an illness to further try to keep the inflammation tapped down so that we don't get into a really severe inflammatory state.
So as I understand it, what you're saying is that even though you have heard of people that have taken this and have reported doing better, that there's not necessarily any cause and effect there, that it may be that they actually just felt better, or it may be that something else was at play. Because I know that people have wondered whether or not there's enough of the dose of ivermectin even making it into the human cells to be able to, fight the virus. Even so, if somebody's taking it, there may be what's the word I'm looking for? It may seem like maybe it's helping, but there's not really clear evidence that that's actually the case.
That's a placebo effect.
Right.
Yeah.
Okay, good.
And that's not to say that means that the research has shown it doesn't work. Okay. There's a difference between saying that there has been no research showing that it does work versus there's research that shows that it doesn't work. Okay, right now there is not research that shows it, but that's the reason why the studies are needed, and that's the reason why studies are ongoing. And certainly, if larger studies are showing and multiple studies are showing that it actually does have a beneficial effect, then that's completely different. But that's not where we are right now.
Okay, so I want to wrap up this episode by just asking you then, if ivermectin is not something that either you're recommending or that is FDA approved from a pharmacological perspective for treating coronavirus, are there other pharmacological interventions that doctors may be taking that could be useful?
Yeah, so there is an antiviral called remdesivir that is somewhat helpful. It really never took off. It's really questionable. It is something that is being used in a hospital setting. Monoclonal antibodies, however, has been something that's been found quite successful. It's available as an outpatient. At least in Florida, it's widely available. It is no cost, a person who has a positive test. And so really it's able to be used for people who are getting more sick or who are at risk of getting more serious COVID cases, which of course, at this point in time, we don't know who those people are. So from my perspective, I would be kind of quicker to use monoclonal antibodies if it looks like things were heading in the wrong direction or if a person was at high risk in the first place.
Okay, great. And I do want to remind everybody that we have a really great video that is actually on that topic, where we dive pretty deep into this idea of monoclonal antibodies, which is a very foreign concept for a lot of people. We seem to be learning a lot about medicine during this pandemic. So that's going to wrap up today's episode. Thank you so much for joining us. Please remember to subscribe, and in the description below, you'll find lots more information, including links to other content. We hope to see you again soon. Thanks so much.